our goal and one of the biggest things for our community is to keep our mamas and our babies here with us at United Regional. We are currently a level 2 designated special care nursery. And what that means is that we have the ability to care for babies down to 30 weeks gestation. There's a great need in our community to transition to a level 3 NICU. Not only will we be able to step down and keep babies at a lower gestation, down to 26 weeks gestation, we will be able to keep our mamas here on our antepartum unit. Right now, they're going to Fort Worth and they may be there for weeks at a time before they deliver their baby.
Planning and moving towards going to a level 3 NICU requires a lot of growth and experience. Our nurses have gone through a tremendous amount of training. I've had the privilege of working as a NICU nurse and being in a hospital that services babies down to that small. What we could do here at United Regional and what these babies and what these families would be able to have would be a big burden lifted off of the families, and it would also keep families closer together.
Going down to 26 weeks gestational age takes a special set of skills. Every touch that we have with them and every interaction with those babies is super crucial for their lifelong development. And so our nurses need to have that skill set and that knowledge in order to best care for these babies. So my role will then be to help them understand how to care for a baby on those special ventilators. We will be doing drills and simulations, how to touch with them, how to interact with them, how to keep the sound and the lights low, how to position them to most effectively help them ventilate their lungs. We've been through training on how to feed these babies, but when they're smaller, there's things that they need to be looking for specifically, for those lower gestational ages.
My youngest son and daughter-in-law had twin baby girls on January 22nd. They were born at 36 weeks, so a little early. We expected them to be early because they were twins. They had to go in the special care nursery because they were so early. One of the best things was being able to be there, being able to not have them be sent off to the Metroplex. We got to see them every day. We got to be there and, support our son and daughter-in-law. It was great having the ability to keep the babies here at United Regional. We all live here locally, so being able to stay here and spend time with them, and the staff at United Regional was all fantastic.
I recently had a little baby boy 4 months ago. He was delivered at 29 weeks. I went into early labor and I had to be care flighted to Fort Worth, where he had a long NICU stay of 2 months. If we had a larger NICU, I think it make a tremendous difference. Not only just be able to be in your own home, you're able to travel back and forth from your house and not have to worry about, taking care of your home, and especially people that have children.
We serve a county and a community that is enormous. Between the Metroplex and Oklahoma, we're the only level 2 facility that has the capacity to care for babies that young. This would be a very big privilege for us to be able to not only impact the community and be able to care for babies down to 26 weeks, but to also service this many people in this community. Building a neonatal intensive care unit here in United Regional would be so phenomenal.
From the bottom of my heart, I just want to say thank you to each and every one of you who make a donation. It will make a huge impact to everyone that is admitted into the special care nursery. Those babies in our future will be able to stay here, and it will be a gift.